And we are here with Dr. Benjamin Marcum from the Stephenville Medical and Surgical Center. Dr. Marcum, thank you for joining us again today. We really appreciate it.
Sure thing.
All right, I wanted to start with just kind of your take on something. There was an email yesterday stating that there are 23 new cases here at Tarleton just in the last week. Large gatherings where social distancing and mask wearing were not observed, and emails from yesterday from a student and a staff person at Central that had tested positive. And I just wanted to see where would you say we stand right now in Stephenville and Erath? Is this more than you expected, or are these still relatively low numbers?
I think we're right back where I expected us to be. Tarleton is not the only university that has a problem with students not social distancing and not taking the precautions that we put in place seriously.
Mm-hmm.
And it's to be expected. Lots of Tarleton kids, they just, they all think they're 10 foot tall and bulletproof, and so young people are that way. And so we expect there to be some degree of noncompliance. Those of us who are in leadership roles have done everything we possibly can to keep people safe, but there's always going to be a few who don't. And I know Dr. Hurley's been pleased that the vast majority of students at Tarleton have done what they need to do. And it's just a small few of those who might have kind of flaunted the rules a little bit. And so, I expect that they'll come around. I knew there would be more cases at this point. It's just inevitable. It's going to happen.
Mm-hmm.
And so, when we get groups of people who don't usually spend time close to each other, if you put them together, well, then there's going to be some spread of the virus, and it's just kind of inevitable. The hope is that we kind of keep it under control so that we can continue to keep going to school and going to class and in Tarleton, and that we don't have to shut everything down completely where everything's online and then we're all staying home again.
Yeah.
So that's certainly our goal is to not let that happen. And so I think the majority of people know that could be a consequence if we don't try to keep the virus in check, and they're doing their best to keep it that way. And I applaud those efforts and ask those of you who may not have to try to get on board.
Yeah, I would say that from my perspective, students by and large are doing really, really good with that, and faculty and staff as well. So definitely not out of the realms of what would be expected at this point with school starting and students coming back.
Absolutely not. And even if we take every precaution and everybody wears a mask and everybody washes their hands, there's still going to be an uptick in cases just because you have more people congregating. And there's just nothing you can do about that.
Yeah.
It's the cases that happen because people don't do what they know they ought to that are frustrating. But, even in the ISD, I drop off my daughter every morning, and in the elementary schools, I have noticed increased compliance with mask wearing amongst elementary age children. And so, those parents and those kids are taking it seriously, and they're getting on board. So they're doing great.
Yeah, and I wanted to touch on that. The ISD sent out a video earlier of yourself with your kids and talking about wearing masks. And your son is in kindergarten, I believe. And so would you suggest that kids as young as pre-K and kindergarten wear masks? I guess that's what you were suggesting in the video, but just touch on that if you can.
Yeah, I do. It's not a requirement from the Texas Education Agency that those kids wear those masks for them to go to school, because realistically, there's some of those kids that just won't or can't. But the best we can try to do that, the more likely your kid is not going to have to quarantine. So if a teacher or a staff member becomes ill, or a class member becomes ill, and your child was wearing a mask, well, then according to the TEA rules and the ISD rules, your child is not going to have to quarantine for 14 days. But if your kid was at school without a mask and their teacher becomes sick, well, then they're going to be home for 2 days, and you're going to have to figure out what to do for the 2 weeks.
Yeah.
For 14 days. You're going to have to try to figure out what to do with those kids for 14 days. And then you may become sick and miss work for 2 weeks. And so it's really cheap insurance. If you can make sure that your child is wearing a mask, then you'll be able to continue to send your child to school even if they are in contact with someone who's sick. And so, if you can get your kid to wear a mask, and mine do fine. We've practiced with them. They're used to it. They know why they're wearing a mask, and they know how to do it appropriately. And so they're doing it. And their teachers know that we expect for our children to wear a mask, and then all their teachers have to say is, if you don't wear your mask, I'm going to touch base with your parents, and then my kids put it on because they know that mom and dad are not going to be happy. So, so you know, even my kindergartner knows that he needs to wear that mask, and he knows that him wearing it is protecting his ability to go to school. Yeah. And so anyway, he's excited about that, and he's wearing it.
For sure. And so it's not an all or none. Like, the more kids that are wearing a mask, the better the outcome overall.
Right. And the more we will limit the virus's spread. You know, we'll just have less cases. The more people wear masks, the less cases you have. It's an inverse relationship. Yeah. And so the science, I mean, it's been studied and studied and studied and studied. We know that wearing a mask cuts down on the number of cases. It's not going to stop all of them, but it will cut it down.
Yeah. So saying, well, none of the other kids are wearing a mask, so we shouldn't, really isn't the best way to look at that.
Right. I tell my kids that I'm not in charge of those other children. I'm not their parent, but I'm my kid's parent, and so that's what we're going to do.
Yeah, okay. That's great advice, and we appreciate it. So a few weeks ago, well, just one more thing on the mask. I was kind of curious from your perspective. You know, some people wear cloth masks. Some are wearing the neck. I believe they're called gaiters that pull up over the face, and some, you know, paper mask or bandanas. Is there like a preferred solution of that for you? Like, would there be a type that you would suggest if someone had the ability to choose?
Good question. Yeah, Wake Forest actually did a study on this, and they studied how many droplets are stopped by different materials. And of course, the thicker the material, the more droplets you stop. Mm-hmm. If you have a real porous mask like a gaiter, it's going to stop a few, but it'll stop some, but it won't stop near as many as if you're wearing a surgical mask or even a cloth mask that has a homemade filter inserted into it. And so while our regulatory bodies have not said you have to wear a certain type of mask, if you're going to wear a mask for the purposes of trying to stop the spread of COVID-19, it makes sense to get one that has less pores. You know, that the fabric is woven more tightly. And honestly, obviously, the more layers there are to it, the better. Now, we don't want you to put so many layers that you just can't breathe. And I've had some masks that I just can't use because you get 2 or 3 layers in there and you just can't use it. But, you know, that you want to find whatever you can use and be comfortable with, but is the thickest material. And you can just Google Wake Forest mask study, and you'll find that study that kind of lists which material is best for the mask. Okay. Whenever you're using those. So the thicker the mask, the more it's going to stop. Okay? Yeah. I mean, it's just pretty obvious.
So, and the paper masks, is that similar to what a surgical mask is? Or? Mask? Yeah.
Yeah, surgical mask. Yeah, you know, a surgical mask does pretty well. You know, and obviously we use it for surgery. It's not 100%. Yeah. You know, the virus, the virion itself, of course, is smaller than the pores in a surgical mask. The only thing that's going to stop the actual virion is like an N95, right? We don't all have N95 masks. But what we're really trying to stop is those droplets and aerosols, right? And those tiny little droplets are larger than the pores in a surgical mask. And you'll stop the majority of those just by wearing a surgical mask. And those are breathable. They're easy to breathe in. Of course, I've used them all through my training and my practice. And never had any trouble breathing through a surgical mask. Yeah. So, and there, you know, whenever this pandemic started, there was a huge shortage of surgical masks, but it's much easier to come by now. If you put in a little bit of effort, you can find a box of surgical masks, and that would be just as good as any homemade mask that you have at home.
Yeah, and for anybody at a business here in town that's either running a business or works somewhere, the Chamber of Commerce has a mask available for you and your business for yourselves and for customers as well. So there's that.
Just call up July. She'll help you out.
One more question for you. You know, we are kind of heading in towards the end of summer, although it doesn't really feel like it outside, but it is technically, you know, coming towards the end of summer. One of the big talks, you know, earlier on in this whole thing back in March and April were what is going to happen in the fall. Do you see there being a big change or a big impact when we switch from summer to fall, or at least from now that it's warm when it gets cooler?
Right. You know, I think the impact we will see is not so much from the weather, but just from the fact that more people congregate in the fall than they do in the summer. And you know, that's the number one driver for the spread of this virus is just how many people get together. And you know, we've proven that gatherings in the summer still produce outbreaks. So in my mind, I mean, maybe it doesn't spread as easily in the heat. Maybe it's a little bit better to spread it's easier to spread in cooler months. But really, the weather has no bearing on this. What has the most bearing is how many people you're around in close contact.
Yeah.
And when you get circles of people who don't usually get around each other, and you start intermingling those circles, then that's when outbreaks blossom, and that's what we're doing with school. And at some point we just have to do it. We can't live in a bubble for the rest of our lives. I mean, I totally understand that concept. And so basically, the attitude is, well, we're back in school, so we're just going to brace for what happens and do our best to limit the spread. As we do congregate, do those things that we know that we can do to limit that spread. And so that's why wearing a mask and washing hands and trying to stay 6 feet away from people as best you can is good.
Yeah, for sure. And I did hear on the New York Times podcast, The Daily, they were talking about the fall and saying that there's a good chance that the flu cases would be down as well from what we're doing.
Yeah, absolutely. Well, we've as long as I've been in position, we've asked people to wash their hands and cover their coughs and, not sneeze on each other and all that business. But, flu is flu, and people aren't too scared or worried about the flu. They're like, well, if I get the flu, I get the flu. Even though I think we ought to treat it with a little bit more respect than that.
Yeah.
But you're absolutely right. As we're trying to, we shut the flu season down at the end of March last year when we all started socially distancing and wearing masks. We were seeing flu cases pretty consistently coming through our clinic, and then it's like somebody just turned off the spigot.
Really?
The flu stopped dead in its tracks. And we had hardly any summer colds. I had hardly anyone coming in with the sniffles over the summer.
Yeah.
We had some allergies, but golly, we just didn't have very many respiratory infections that weren't COVID. We had the occasional bronchitis or strep, but I haven't seen near the number of just plain old viral illnesses that we typically see.
Okay, so aside from COVID, some other positive effects of distancing and mask wearing and hand washing.
Right.
Well, Dr. Marcum, thank you so much for coming on again with us today, and we hope to talk to you again in a couple of weeks. Thank you.
Sure.